Hi, I'm Megan Albertson, and I'm currently serving as the leader of the Jackson Care Hub. Some of you might know about the Care Hub or even work in it, but I imagine that most of you don't know much about it at all. And that's okay, because we're going to talk about the Care Hub at the next Collaborative Network quarterly meeting in June. And right now, I want to give you just a quick sneak peek to get you excited about that conversation. The Jackson Care Hub is a community information exchange, to which you might ask, what information do we exchange exactly? Excellent question. The Jackson Care Hub shares information about a standardized screening tool for social needs. Our screening asks about 13 social domains of need, things like housing instability and lack of food. If a client identifies a need and consents to help, our community health workers help refer them to our local service partners who do a really great job at supporting our community. So the Care Hub 1 identifies a need and 2 connects people to resources, which is pretty straightforward, right? This whole screening and referral thing is really cool. Obviously, it helps people in need by connecting them to available resources, sure, but it also does two other very important things that will be the highlight of our discussion in June. Very cool thing number one, it creates a formal connection between clinical healthcare services and social services. We all know that overall health has way more to do with social and environmental conditions than with seeing a doctor. But what we have not yet been able to do, really anywhere in the US, is structurally connect social and environmental services to the apparatus of healthcare. But doing so could be a tremendous benefit to our community wide systems of care. The emergency department, it turns out, is a terribly ineffective place to fix homelessness, to fix addiction, to fix the tyranny of immediate acute social crisis. But we know that's how the emergency department is used by lots of folks who feel like they have no other options. So, how do we create those other options? We build them together, which is part of the whole connection across agencies thing. Because and listen, I say this next part with love and humility as a longtime employee of our hospital system, but we are not very good community partners, especially when it comes to coordinating care and working upstream on prevention. Healthcare needs to do better. And the Jackson Care Hub is a way to organize the development of that interagency care coordination. Number two, very cool thing that the Jackson Care Hub does. It makes pretty data stuff. And y'all know I'm about that, and I know that you are too. Because it turns out that screening data combined with referral data, combined with service data, is a map of the care delivery system in Jackson. The data doesn't create a map through some mathy tech process. It is a map in real time, and it can tell us a lot about the services in our community. And I think most importantly, the services not in our community. When I say that the Jackson Care Hub, one, identifies a need, and two, connects people to resources, a reasonable response is, what if there are no resources? It turns out that that's not just a good question, but it is the question. Because we know, right? We know that there are many instances when the need is bigger than the care that we can provide. There are many ways that people get trapped and stuck, and there are too many spaces where there simply is no formal system at all. There are gaps, and that's why we're here. Because the true extent and impact of those system gaps are virtually impossible to understand, let alone address, from within any one organization. It is only by looking at the interplay across the community that we see the truth. It is when we have the courage to look across the people and agencies and policies and funding and eligibility criteria and all the chaotic, painful, real life stuff that happens to real live bodies. It is only in that messy, scary space that we can see what is needed to transform ourselves into a community that is just, a community where everyone thrives by design. And that is our goal. And that is our responsibility as the chosen few with the power and resources and the ability to show up together here and think about a better way. The Jackson Care Hub did over 132,000 social needs screenings in 2022. We made over 7,700 referrals. Those are pretty big numbers in a town of 160,000. There is a lot to discuss. So let's do that. Thank you for your attention here. I'm sorry I couldn't be there with you today, but I'm excited to see you all live and in person in June. Peace.